Every mom-to-be knows that pregnancy can take its toll. Despite showing attitudes of optimism and pride, a pregnancy can have risks and potential complications. Delivery are beyond our control. One of the complications arising being preterm births, the leading cause of neonatal mortality.
We have the mild preterms who are between 32 and 36 weeks. Then we have the very preterms who are up from 28 weeks up to 31 weeks. And then the extreme preterms extreme preterms who are now below 28 weeks.
A visit at the Kijabe Mission Hospital Newborn Unit, Neonatal Intensive Care Unit, where critical preterm babies are taken care of, one can almost smell colostrum hanging in the room. Figures released by the Ministry of Health indicate that of the 1.5 million live births in Kenya annually, 188,000 are of babies born too soon. Bob Okeyo, a doctor at Kijabe Hospital, tells on how dire the situation is in the country.
Statistic that was put out by the Ministry of Health say that about 1.5 out of 1.5 million live births, up to close to about 200,000 are going to be born preterm, which means below 37 weeks of.
A premature birth is a birth that takes place more than 3 weeks before the start of the 37th week of pregnancy, some weighing as small as 700 grams. Normally, a pregnancy usually lasts about 40 weeks.
Most of them would deliver below 37 weeks, like already stated, which means that the baby came in too early. Labor pains came and the baby was delivered.
In many cases, the reason for the premature birth is unknown, but Dr. Okeyo tells us the risk factors that claim about 14,000 preterm babies yearly, translating to about 1,166 deaths per month.
A few to mention: diabetes, hypertension, cardiac diseases, renal diseases, nutrition. Parents who don't feed very well puts them at high risk of delivering preterm babies.
Premature birth gives the baby less time to develop in the womb. Premature babies, especially those born earliest, often are at increased risk of illness, disability, and death. Many technological advances have been made to help treat preterm infants, part being the incubator, which mimics the uterus.
In the womb, of course, there's fluid and all that, so there's free movement. They're floating in amniotic fluid. Here, then out in the environment. So movement may not be as much as it is. Their capacity to be able to survive outside the normal natural environment has been impaired.
Despite the ups and downs in navigating the broken public healthcare system, Dr. Okeyo alludes to the fact that follow-up is key and that the cost of this service should not put the patients away.
It's not a matter of delivering a preterm baby, caring for them until they go home, then you set them free. No, they need follow-up. There are very many complications that can arise that you may be able to pick up as one that handles neonates or preterm babies. Kenya is ranked 15th out of 188 countries with the highest number of preterm births, the leading cause of death in children under 5 years. Ouma Onyango reporting for Talk Health on KUTV, Nairobi.